Welcome and thank you for joining TANF Next Practices, Lessons from COVID-19, Informing Innovation and Modernization. Before we begin, please note this event is being recorded. By continuing to be in the event, you are consenting to be recorded. A recording of this webinar will be available online a few days following the presentation at PeerTA.acf.hhs.gov. Ensure you have opened the participant and chat box located at the bottom right of your screen. Having issues hearing the event, click on the caret icon next to the unmute icon and check your speaker settings, and/or contact the WebEx host within the chat box. Please keep in mind all attendees will be muted for the duration of today's event. If technical assistance is needed, please send a chat message to the WebEx host. To submit content-related questions, select All Panelists from the drop-down menu in the chat panel and enter your question in the chat box and send. We will address as many questions as possible at the end of the presentation. With that, I'll turn the conference over to James Butler. Please go ahead.
Hello, everyone, and thank you for joining today's webinar. As already mentioned, I'm James Butler, and I serve as one of the program specialists here in the Office of Family Assistance in DC's central office under the leadership of Lisa Washington Thomas. As one of my many duties, I have the pleasure of leading PeerTA, through which this webinar is being hosted. For those of you who may not be familiar with PeerTA, it's one of the projects that OFA supports for state, county, local, and tribal TANF programs to receive responsive and evidence-informed training and technical assistance. One of the main goals of PeerTA is to establish linkages among TANF agencies and their partners serving TANF and low-income families to increase program effectiveness. At the end of today's webinar, we will explain how you can access PeerTA for training and technical assistance through OFA. So for the last decade, states have engaged in efforts to modernize, redesign, reconfigure, and realign the TANF program so they are best positioned to support the physical, social, and emotional well-being of families and advance their economic mobility. Even in the throes of COVID-19, state and local programs have persevered through to advance these efforts and use lessons from the pandemic to innovate, revitalize, and reimagine their programs. Today's webinar will assist TANF programs just starting to think about possible innovations and modernization, as well as those deep into the journey. So please join me in welcoming Ms. Mary Nelson from the American Public Human Services Association, Bianca Bell and Joan Schatz from the North Dakota Department of Human Services, WAFAM from the Pennsylvania Department of Human Services, and Christina Metza from the California Department of Social Services. If you'd like to know more about our presenters, their bios are attached to the invite. We're going to hear about principles modernization from Mary Nelson, and then dive into the journeys of these three states, including where they began, what they are currently doing, and how the COVID-19 pandemic has impacted their work. Also joining me today is OFA's PeerTA Project Director, Mary Roberto from Manhattan Strategy Group, who will take it from here. So Mary, you have the floor. Thank you.
Thank you, James. Hello, everyone. Thank you so much for taking time out of your day to join us for this webinar. As James mentioned, my name is Mary Roberto, and I am the project director for PeerTA and work with Manhattan Strategy Group. And I'm so excited for today. We've been working together with the presenters for a while to, especially Mary Nelson with APHSA, to come up with a great presentation for you today based on some experiences of these states. So as a reminder to start out with, throughout the presentation, you'll have the opportunity to offer ideas and ask questions through the chat box on the bottom right-hand corner, as Rita mentioned earlier. And please be sure to state who you would like your question to go to. If there's a specific presenter that you want to answer the question. And if we don't get to everyone's questions today, we'll be sure to put those together and get as many answers as we can out to you when this is posted on the PeerTA website. So we'll provide an audio transcript of today's presentation as well as the slides and for you for future reference. So the objectives for today is for you to become familiar with the history of TANF modernization principles, as James mentioned earlier. This modernization, the attempts towards it, the practices around it have been going on for many years now, and so there's much to share about lessons learned. You'll consider what state and local human services agencies have developed as TANF modernization core principles and strategies. Discuss the experience of different states. So as you know, there's 3 with us today that have been through quite a bit with COVID and their initiatives to strengthen their programs and to become more effective and efficient. And then we will identify steps for your own TANF innovation and modernization journey, like where do you start when people say, I want to modernize my TANF program? What does that really mean for you, and how to take some steps towards that? And then we will go into how to access PeerTA for assistance in these efforts. So like I said, we're fortunate to have some great presenters today. So I'm going to go ahead and get started with them. And but first off, we're going to start with a poll question. So Rita, if you want to pull that up, what we want to know today is have you been considering or working towards any of the following in your program? So adapting work activities and measuring success, so both process and outcome driven activities and measures, exploring diversity, equity, and inclusion in your program, the frameworks, or providing opportunities for staff to engage in DEI training, developing innovative partnerships or approaches to meet family needs, such as including, partnerships with housing, childcare, mental health services, and so forth. Provide barrier reduction services, case management, and coaching. So I know there's many programs out there that are looking at more family-centered approaches to services, improving IT infrastructure. So when people say modernization, are they talking about modernizing systems, the ways in which people engage in the program over technology, and then integrating the voices of families in service delivery. And we'll talk a little bit more about that. So have you been considering or working towards any of these in your own TANF programs? And if so, which ones? So you can check all that apply. We'll give it a couple of seconds here and see what y'all come up with. Wow, there's some like really great responses here in all of the areas. So most of you are providing barrier reduction services or moving towards that 29 there, and then developing innovative partnerships is the second. The third is adapting work activities, which I'm sure many of you have had to do over COVID, really trying to figure out what will work in the midst of all of that chaos. And then the others are improving IT infrastructure, and about the same for diversity and inclusion frameworks and training, and integrating the voices of families into service delivery modification. So thank you so much for responding to the poll. And without any further ado, I want to transition now to Mary Nelson with the American Public Human Services Association. And Mary's really going to dive in with us, talk about TANF modernization and the core principles that APHSA has worked with TANF leaders around the country and really put a nice framework together. So Mary, I'm going to hand this over to you.
Thanks so much, Mary, and I'm really excited to be here with you all today. For those of you who are not familiar with the American Public Human Services Association, or APHSA, we are a membership association for state and local human services agencies. We often say that we influence modern policy and practice, we build field capacity for our members, and we connect human services leaders and policymakers. In addition to being a broader membership association, we also convene several programmatic affinity groups, including the National Association of State TANF Administrators, which I have the great pleasure of being the staff liaison to. So if you have any questions about APHSA or NASTA, please feel free to reach out to me. If we can go on to the next slide. So today, as Mary mentioned a couple of times, I really just want to set the stage with a little bit of context around these modernization discussions and how we at APHSA and our members have approached these discussions. So for many, many years, long before I was at APHSA, our members have been having conversations about ways to improve TANF programs to really impact the families that it serves and maximize its potential. So in our most recent conversations over about the past 2.5 years, we really wanted to take a moment with our members of TANF administrators, human services executives, and other agency leaders to try to establish consensus around what the core principles that any modern TANF program should embrace. So really trying to establish a framework to think about the possibilities of TANF reform and what a vision for TANF could be. So really the first thing we wanted to do, if we go to the next slide, is to set our terms and to make sure we were all on the same page about what do we mean when we say modernization. So we have our definition here. So to design and implement long-term strategies for advancing TANF reform to improve employment outcomes and provide the tools needed to build child and family well-being. So just to kind of make sure and level set, we're all talking about the same thing. And this is not to say this is the definition for TANF modernization. This is really where we started with our discussions with our members. So secondly, if we go to the next slide, we wanted to kind of really think through who needs to be at the table. And I should say, I am not a mechanical engineer. I don't know if this mechanism going in this direction would actually work, but we're going to pretend for the sake of this presentation that this is completely functioning as a mechanism. So when we think about who needs to be at the table to have discussions around TANF reform and TANF modernizations, we know that TANF administrators don't do this work alone. There are a lot of other folks that need to be at the table, and you can kind of see them labeled in this diagram. So we need to think about how partner agencies, including those in workforce agencies, WIOA programs, child support, child care, food supports, and many, many other meaningful sister agencies can partner with TANF to support moving health and human services upstream. There's also opportunities to engage legislatures, state legislatures, gubernatorial staff, and advocates who can promote positive change within TANF programs to support the families we serve. We also need to make sure that staff at every level, so not just our leaders or our executives, but also staff at county levels, frontline staff, and all of those involved in the process can be brought to the table to be a part of the conversation and identify opportunities and barriers to advancing TANF reform. And last, but really most important in this process, is the ability to engage families as co-creators and co-designers of policy and practice. So you can see in our diagram here that even though TANF families are highlighted in the center, we have our little people throughout the diagram, and they are pushing and pulling the mechanism. So these are families, and really meant to represent that family engagement should really be embedded throughout the process, because the people who are the experts of their own lives are the TANF families themselves. So we also can think about, in establishing a framework, how this can support everyone who is engaged in having a shared understanding of what the core principles of TANF reform are and what we're really working towards. And I want to kind of shift to take a look at what our members came up with as a framework for TANF modernization. So if we can go to the next slide. First and foremost, what we heard from TANF administrators, from human services executives, and other key stakeholders is how important it is to state upfront in every single conversation that equity must be embedded throughout. So we established this North Star statement. You can see it, and I'm going to drop in the chat a link to the full graphic of the TANF modernization core principles. But you can see this is at the top of that graphic. We also include it at the top of every conversation that we have. So just to read a few key statements from this, we maintain the values of equity, inclusion, and the limitless possibility of human potential as a clear North Star. These values must serve as the foundation for building modern TANF programs to support child and well-being for generations to come. And really, I think that it's important to note that it's one thing to say, of course, equity is embedded in everything we do, but when you intentionally place that at the beginning of every conversation, it can really have a powerful impact in the way that you approach these conversations. And I think that it's meaningful that our members and stakeholders shared that it was important to them to have that stated up front. So before we shift on to the individual core principles, I just want to kind of share what I think that these really embrace, and that's prioritizing child and family well-being in addition to career and economic success, creating a system that fosters individual solutions and agency in people's lives, emphasizing TANF's role in a coordinated system of care that moves health and human services upstream, and really ensuring that people have what they need to be successful in their long-term and short-term goals. And so we tried to take all of that and express it in a set of core principles that really support the idea of working backwards from this vision of TANF to say, okay, now what are kind of the ticky-tacky policy and practice changes that you'll hear about from our state representatives today that we need to make to get to that vision of TANF. So if we go to the next slide, you can see we came up with 6 core principles. And I know that this is difficult to read. And I've also shared the full graphic in the chat if you'd like to open it up and see the larger version of this. You're also welcome to share that and to save it and review it later. Maybe it's your nighttime reading. So starting at the top, a core principle 1 is to help families achieve economic mobility. TANF must support the physical, social, and emotional well-being of individuals and their families. So not just thinking about career supports and not just thinking about how we serve parents, but also thinking about how we serve children and whole families, and also the physical and social well-being of those families. Secondly, TANF must prioritize tailored solutions that help families succeed for the long term. So we're not just interested in immediate stabilization or emergency response. We want families to really be able to attain economic mobility in the long run. Thirdly, TANF should foster conditions that advance a person's sense of agency over their life and belonging within their community. And I really think 2 and 3 complement one another in pointing out that, again, individuals are the experts in their own lives. We should give them some ability to guide us in how they want to proceed in their short-term and long-term goals. Fourthly, the best To best help families achieve their goals, TANF policies should be centered in evidence and promising practices that reflect the lived experiences of families. So not just thinking about data and evidence, but also thinking about how we incorporate family voices and family expertise into the process of program design and policy implementation. Fifthly, the broader workforce system must provide a coordinated continuum of services that support all job seekers' goals, strengths, and needs. So not just thinking about how do we support families when they are receiving TANF, but how do we support families in creating career pathways that will live beyond TANF and will support families in receiving services and supports as they transition to different systems. And then finally, 6, families must have access to adequate assistance and services that allow them to meet their basic needs while working to achieve their long-term goals. So really just making sure that families have what they need to be successful, both in their short-term and emergent needs, but also as they transition off of TANF and hopefully are working towards attaining economic mobility. So if we shift to the next slide, this is really just an illustration, and we're going to hear from some great state examples today. But just to show that throughout this process, we wanted to engage our members and ground the core principles in the real life work that you all are doing to advance TANF programs to support the communities that you serve. So within our work, and you can see this, and I dropped in the chat a link to the National Association of State TANF Administrators. You can find our work around modernization on our resources page and see these examples lifted up throughout that work. So Washington, D.C.'s intergenerational approach to TANF, Maryland's workforce system alignment, and Montana's person-centered service delivery model are 3 examples of where we really have grounded these core principles in the work that you all have done to really be able to show that we know what works, because states have been doing this work for many years to ensure that TANF programs are adequately designed to support the families in their communities. So with that, I'm very happy to stop here and be able to yield the floor to our colleagues in North Dakota, California, and Pennsylvania to share the great work that they're doing that really speaks to these core principles.
Thank you, Mary. Bianca, we have a quick poll question before you get started, if that's okay. One more. So if we could advance to the next slide. Yeah, poll 2. Which of the TANF modernization core principles for you all is top of mind? So you heard from Mary. Do you, support the social, physical, and emotional well-being? And you can select all that apply. What is on top of your mind? Not necessarily that you're moving forward with it, but what maybe resonated for you as you think about modernization and innovating in TANF. So we'll give you a minute to respond to some of these and see what you think.
And just a reminder, after making your selections, please click Submit on the bottom right.
Yeah, some of them centering TANF policies and processes and evidence and promising practice that reflect the lived experience of families. I've heard quite a few programs talk about that, lived experience and what people experience and how to translate that back into program effectiveness and change. Job seekers' goals, strengths, and needs. That's one of the last ones. So how does that feel for you? Since the workforce is changing before our eyes, the workforce system, the people in it. How are our responses, Rita? Wow, a lot of people really connecting to the first one, supporting the physical, social, and emotional well-being of individuals and their families, which is kind of the top of the game, right? The overarching focus. And then we have the second one is also highly regarded, prioritizing tailored solutions as opposed to maybe some cookie cutter approaches that some of us have been used to in the past, especially early in the days of TANF, that, getting into work activities and things like that, or what you need to do, and that's not always the case. So yeah, so we have some good responses there. The A and B were at the top, and then D, centering TANF policies, and then E, providing coordinated continuum of workforce services. So I'll go ahead and hand it over to you, Bianca. Next slide.
Awesome. Well, thanks. Before we get started, I just want to say thank you. I think that both Joan and I have her here with me today. She's our expert in our North Dakota TANF policies. We were really grateful for the support that we received from OFA, PeerTA, and Mary's group, and very excited to come and share and talk about our journey through modernization and how we got there. I think while we've really not fully realized, a modernized program at this point, the biggest thing is that we're taking steps to understand what modernization means for us here in North Dakota and what it means for our citizens. And we really see modernization for North Dakota as a marathon and not a sprint. So we've been taking this journey one step at a time. So we'll go ahead and go over to the next slide. Today I'm going to talk with you about our approach, but before we get into that, I'll share with you a little bit about North Dakota and who we are. So the mission of our department is to provide quality, efficient, and effective human services. And really our key priorities that you'll see here on the left on this slide are meant to help guide our work. So our executive team developed this list of key priorities for our whole entire Department of Human Services. Economic assistance is a division within the department. So imagine our whole entire department moving towards these priorities and what that means for us as a state and as a system. I would say about since 2020, our program has really tried to understand how we can meet the needs of individuals that we serve and align with the key priorities. It became really clear to us that our solution that we're looking for really aligns with modernizing, right? So what it takes to modernize the TANF program. And we got a lot of information about modernization, and I will tell you, there's a lot of good information out there, but we struggled with how to get started and what that meant for us. Go ahead and go on to the next slide before I get into that. Another key area that I want to bring your attention to is not only do we look at the key priorities, which include the strong, stable families, early childhood experiences, services closer to home, and efficiency through redesign and high-performing teams, but our key priorities really rest on the idea of the foundations of well-being, and these are meant to be a thread that we take through our programs because they really go through every person's life. Economic health, as you can see, is one of the foundations, and our role as the Economic Assistance Division is just one piece of the puzzle, because when you think about it, stability comes not only from good economic health, but it also comes from good behavioral health and good physical health. Good physical health and good behavioral health are also supported by good economic health. And I'll go ahead and go on to the next slide. So our division, as mentioned, is one piece of the puzzle, and our programs within our division are really meant to help North Dakotans when they're struggling to make ends meet. Our goal is to connect them to resources so that they're able to meet the basic needs and really prevent any greater or more damaging crises in their life. I'll go ahead and go on to the next slide. So a little bit about North Dakota. We've got 4 major metropolitan areas. Our largest metropolitan area, if you think about it, is upwards around 250,000 people, and our smallest is around 80,000 people. So we're not as as our metropolitan areas are not as large as most states. In North Dakota, our TANF services help families with children deprived of parental support or care, meaning a parent is absent due to divorce or separation, death, or one or both parents, or the parents are incapacitated. Our TANF Block Grant provides an average of $311 a month to individuals who are receiving it. And it also, we have our work component where we provide work readiness training, jobs placement services, case management services, and this goes to about 1,000 people per month. So looking back to 2009, as you can see, we also, one of our motivating factors is we noticed that our TANF caseload has really declined. Looking back to 2009, we experienced a 43% decrease in our TANF caseload. So this really kind of brought us to what can we do differently or what can we do better? Looking at our characteristics and looking at the way that our department is going, how can we know that our services are aligning with our priorities and really are doing the best job that they can for our citizens in our state? So go ahead and go on to the next slide, please. So our approach. I'll say the end of 2020 was really a big key moment for us because we submitted a TA request to really begin the process. We really appreciate all of the support that we got from TA and looked at it as an opportunity to build some internal capacity to help us with understanding, how do we tackle this? This is a pretty large idea that we have. We want to really change a system. So we wanted to, when we initially asked for support, we wanted to do this thing that we were calling an environmental scan, and we still reference it as an environmental scan today. But we really wanted to capture the current state of our services and understand people's perspective on our services, our internal partners, as well as our external partners, as well as the voices of the people who have a need for service or have received service. So we submitted this request, and in the spring of 2021, this work came really into fruition when we partnered with OFA PeerTA to conduct what we're calling, I guess, the initial part of our scan. And we basically asked for all of our partners to come around the table and to help us engage in this work. And this was the first time that we really had engaged with stakeholders or partners in quite some time. As Mary mentioned in her presentation a few seconds ago, it takes a lot of people to really think about how we make change. And we realize that this doesn't happen in a vacuum. So before we invited everybody to the table, we really thought really critically about who we wanted to come to the table. Some internal partners that we invited included our internal staff. We included people who are working directly with individuals, so people out in the field. We included our child support agency, children and family services, our vocational rehab office. We also wanted to capture the voice of the individuals and families we serve. So I'll talk a little bit more about how we did that and what our approach was in the next couple of slides. But for our initial gathering, I'll go ahead and go on to the next slide. We wanted to really get a good idea of what everybody around the table thought would make our services the best that they could be, right? So we developed a framing question and we asked everybody to consider, imagine if North Dakota Department of Human Services and surrounding community-based agencies led the nation in understanding and meeting the changing needs of their TANF population and the people that we serve. What would that look like? And I'll say that this framing question really helped to focus us all on a common goal, because all of the people around the table had their own experiences, and I think that they could understand this question from their own experiences. Okay, next slide. One of the things that we implemented through our TA process was the use of a framework called the strategic doing process. And the tagline for strategic doing is doing more together. And when we first got started with the framework, we weren't experts in this. Our TA folks really helped for us to understand how to implement the framework. But as we were going through the process of implementing this framework, it was really easy for us to figure out how to use the initial workshop that we had. Participants were led through a structured set of conversations and guided through some specific exercises to really think about the opportunities that were out there. What were some of the things that they could bring to the table? What were some of our, big wins that we could make together? I really liked the fact that it asked for people like our partners to think about what skill sets they had and how they could contribute to helping us work towards this effort of being the leading agency in providing services. It also asked for us to think about at least one outcome that we would like to achieve, and we had to come up with some measurements. We completed an action plan, and we also worked on plans on when we were going to meet again. And to kind of simplify this idea of strategic doing, I'll go to the next slide. It really asked for us to consider, okay, from our own perspective as a group, what skill sets do we have? What could we do together? What should we do together? What's our 30-30 and what will we do? So our 30-30 as a part of this process was really holding us accountable to monthly check-ins and making sure that we had people accountable to help us move this process along in the what will we do. Go ahead and go on to the next slide. And this framework really gave us a lot of good information. I think that it was, we asked for an environmental scan, and here I was thinking we were going to do all this research and try and understand North Dakota. But a lot of the information that we got about understanding North Dakota and our services came from the work of our stakeholders. Team 1, we broke out into 2 separate teams, and Team 1 really focused on understanding what other states are doing. So they hosted 3 virtual site visits, and they wanted to learn about strategies to improve access to TANF assistance and gain some insight on what regulations and policies and procedures should be reviewed for changes. They also discovered some different client-centered tools and approaches to help engage TANF participants. Team 2 was really focused on understanding customer experience and staff experience to get a sense of the current needs of the TANF population. So I kind of said earlier, we wanted to capture the voice of the individuals that we serve, and Team 2 really focused on understanding that. So taking the information from the customer experience survey, as well as hosting a couple of focus groups to learn directly from participants what they felt were barriers, as well as what was working, right? We want to know what's not working, what is working, so that we can amplify the things that are working. And I will say, for the most part, this effort was largely championed by our stakeholders, right? So our 2 teams were really the key in helping to gather all of this information in a really short amount of time. So we'll go ahead and go on to the next slide, and thinking about the environmental scan. So we had a lot of good strategies to get out there and get information. But in terms of what we learned, we had some findings in some very specific areas. Financial benefit was one of the themes that came through. Program requirements was another one. So nothing too surprising, right? I'm sure that you all could probably relate to this. Job support services and support from workers. Thinking about financial benefit, we had also noticed that if we were going to, you know, need to make any changes, what areas and what areas would we need to kind of focus on based on this theme. So you'll see policy across the state, resources, and internal procedures and practice and technology. So we have this really high level matrix, but to give you a sense of the value of information for financial benefit, that really ranked top for the people who completed our survey. They said, you know what, financial benefit is really the first choice on why I participate in services, and it's not enough. Our program requirements, we really heard from people that proof after performance, or I'm sorry, pay after performance and proof of performance really really impacted the timeline on how people receive their benefit, and that's more of a challenge and a hurdle than it is helpful. Transportation underneath our support services. It was kind of interesting because we learned from participants that that's not necessarily, that's the biggest challenge for them. Workers actually identified the biggest challenge as being caregiving. So workers were seeing that caregivers, or finding caregiving to participate in programs was the biggest challenge. But people who participate in services was saying, no, that's not an issue for me. My biggest challenge is transportation. So we got a lot of really great insight, that's going to help to support our changes. I'll go ahead and turn it over to Joan so that she can talk a little bit about what we learned and where we're headed.
Next slide, please. What we've learned is during the process, we learned that stakeholders have their own areas of expertise, and we were successful because we were able to engage them in their own areas of expertise. We found that our stakeholders were willing to dig in, participate, and complete work. Part of the engagement was we kept our stakeholders informed of what we were doing. We did this by sending emails, inviting them to meetings, and scheduling meetings around their schedules. We actually found that we shifted our internal planning meetings to meetings engaging solely with them. Next slide, please. Where we are today, we completed the efforts behind the environmental scan. We are considering the data, determining the next steps to figure out how to help our citizens, some of the considerations based on what we've learned, removing policies based on what we've learned, some of the considerations based on what we've learned, removing policies that negatively impact families, looking for policies that support families. And we've applied for more technical assistance to continue building capacity around understanding how to approach these changes. Next slide, please. What we have gained from stakeholder engagement and technical assistance, we have built a stronger working relationship with our stakeholders by taking interreactions outside of the day-to-day working relationships. This has led to a goal of building better services. We will have all the information we feel is necessary for planning future strategies and initiatives. The report that we are developing is in draft format, and we are still in the process of reviewing the draft. We are learning new strategies like strategic doing and ally squares. These are tools that are simple to apply and can be used in future stakeholder engagement efforts. Peer exchange and interreaction. Currently, we are part of a 10-site team. Coaching and encouragement, subject matter expertise from technical assistance, but we are also learning about client perspective, informational resources. Next slide, please. What's next for us? This spring, we are planning to share the findings that we are working on with legislators and stakeholders and develop long and short range goals for our strategic plan, involve stakeholders, and prioritize efforts.
And hello, everyone. My name is Wafam, and I'm here representing the Pennsylvania Department of Human Services as our state's lead TANF agency. Thank you again to our wonderful hosts at OFA PeerTA for organizing this session. I'm particularly excited to be here with you all today to share insights into the department's TANF E&T modernization efforts over the last several years. So our modernization journey started in earnest in 2018 when the department was facing both internal and external, I would say, scrutiny of our TANF programs, with priorities of new executive leadership, pressure from advocates, and quite frankly, some unsavory press. The department set out to deepen our understanding of our own programs, right? Acknowledging that there might just be a disconnect from our intentions here at policy headquarters, right? That intention to improve the lives of our TANF recipients and our impact, or what was happening on the ground with our provider partners and our end users. And further, we really wanted to investigate what more or differently we could be doing to drastically improve the long-term economic security of our individuals and families who are receiving TANF in Pennsylvania. So we ventured into the realm of something, both simple and radical all at the same time, to very much so what North Dakota did, to ask our stakeholders for candid feedback on their experiences with our program. So, if you're listening to this and wondering to yourself, oh goodness, I'm scared that we might open Pandora's box, or I don't know where to begin, I totally understand that. I think that's all the more reason that you should do it and to seek out the help of others who can support you, much like the folks on this call today. So for us here in Pennsylvania, we wanted to get a full spectrum of input. So we mapped out our core stakeholder groups, again, many of the kind of gears or wheel spokes that Mary Nelson shared earlier, including program participants, contracted program providers, internal program and policy experts here within the department, and other interagency partners like our colleagues in labor and industry, and of course, our client advocate groups. We invited individuals representing everywhere from frontline staff to leadership from each of these stakeholder groups to share their insights and thoughts through a series of stakeholder group specific town halls and meetings, and then replicated that kind of process or model across 3 major geographic regions across the Commonwealth. And finally, in addition to casting this really wide and deep net of who we engaged, we wanted to be very intentional about how we engaged them. So with these listening sessions, we really wanted to create spaces that would elicit unfiltered and actionable feedback. So these conversations were designed to be in person, in small groups, and protected. So for example, we actively prohibited our TANF eligibility workers from engaging in any way with our participant town halls to ensure that our program participants felt safe and that their feedback wouldn't impact their cash grant, for example. We asked open-ended questions about our stakeholder experiences, like when you started this program, what were your goals? And how did this program support or not support your short and long-term goals? And I would say that these conversations surfaced many eye-openers. Stakeholders across the board described some pretty significant challenges with navigating our system, and that often what we were seeing as non-compliance from the experiences of our stakeholders were really not intentional. Our stakeholders were highlighting challenges related to, relying solely on public transportation to participate in programming, or challenges identifying access to affordable childcare, or just broadly, generally, living through the stresses of living in poverty. And I think these challenges were also reflected in our measurable outcomes as well, namely with low referral to program enrollment rates, with job placements with low wages, and high program recidivism. And these key themes ultimately became the basis of what I would say is really radical transformation for our statewide E&T system. Next slide, please. So in 2020, the department launched a reimagined E&T system that we'd hoped would, again, bring our intent to drive long-term economic security into a reality. And more importantly was fundamentally based on the feedback of those closest to and most impacted by our system. So with this redesign, we shifted our entire system, whose focus for decades was to drive immediate job placement in any job, regardless of job quality or good fit for our participants, into a system that was much more mindful and responsive to the wide variety of needs of our customers. Overall, our redesigned system was set to include a more kind of thorough whole family needs assessment and allow time to meet participants where they are, while also expanding access to education and training options that ultimately were designed to help our customers reach their individual job and career goals. So a couple of things that we built into this new system. So first would be implementing an intensive case management and individualized coaching model. In this case, service providers are conducting thorough assessments, developing participant plans in collaboration with our participants, and assisting in barrier remediation and providing supportive activities on that kind of individualized plan, again, driving towards those individualized goals. With this new program design, we've increased our expectations of our ENT vendors, which here in Pennsylvania is our local workforce development boards. Our partners now are augmenting our efforts here within the department, particularly with our eligibility workers, now to include conducting their own outreach to ensure that those referrals from our eligibility workers are resulting in program enrollment. Our providers are also offering intensive case management, as I mentioned earlier, truly to support our participants' individualized employment plans. We're also offering a broad array of supportive services that ensure that our program participants can not only successfully engage in our ENT programs, but also attach to employment and retain it. This includes services that address challenges, again, that we heard from our town halls and our focus groups, like lack of stable housing, mental health challenges, access to childcare, literacy barriers, or access to credential bearing training. So our ENT network, our contracted providers, are now required to have available a licensed counselor, either on staff or as a contracted provider, to provide additional mental health supports to our participants. And on our end at the department, we've established a fairly robust special allowance program that offers program participants additional funds for childcare, transportation, housing, and technology. We've also stood up parallel programs through strategic partnerships and grants to a network of providers to assist with free professional clothing and legal aid to expunge criminal records that, again, serve as barriers for our participants in securing family-sustaining jobs. Through our redesign, we've also expanded our education and training options to include now ESL and high school equivalency programs, vocational education, including supporting folks to earn their associate's degree through our state's community college system, and an expanded network of credential-bearing job training programs. And finally, we've expanded our retention supports now for our participants, offering up to 1 full year of post-job placement support, again, to continue to drive towards that long-term attachment to employment. And of course, we recognize that our ENT vendors likely needed additional support to meet this kind of new set of program requirements. So continuing on with this theme of meeting our stakeholders where they are and heeding their feedback, the department increased our monetary investment into our ENT program and switched our resourcing structure from a pay-for-performance model into a cost reimbursement model that really was designed to better equip our vendors to test and pivot operations more quickly through this redesign. Next slide, please. So it's been about 2 years into our program transformation and 4 years into our TANF modernization journey, and I'm really happy to be sharing on this call. We're really glad that we took those steps. So for one thing, I think, for modernization efforts that have been grounded in stakeholder engagement, I'm happy to share that feedback from our provider partners has been broadly positive, and that the program changes aligned with, as they reported, they wanted to deliver programming. For modernization efforts that, again, were grounded in participant and provider partner feedback, I'm happy to share that program design, that prioritized barrier remediation services allowed us to be here in Pennsylvania much more responsive to the challenges posed by COVID-19, namely that we had mechanisms in place to offer much needed access to technology to support safe distance learning and mental health supports while we collectively navigated the significant upheavals and traumas of a global pandemic that we're very much so still in the midst of. 3, we've continued to make significant progress internally within the department as well to alleviate administrative burden. Again, recognizing that time spent on reporting or worse, trying to decipher complex guidance issued by the department was time taken away from delivering high quality service for our participants. And 4, we're starting to see that these efforts are paying dividends on some of our metrics. And it's jump-started, the types of measures that jump-started this great experiment, right? High program recidivism and low wages. I would say that over the last year, we've started to see that our referral to program enrollment rates are increasing. Our participants are engaging in more vocational education activities and are remaining attached to our programs for longer. And I'll take this opportunity to add that we've seen increase in enrollment overall in our TANF program, even in the midst of a pandemic where we had issued a statewide moratorium on new sanctions and other punitive related steps to force or encourage, depending on who you ask, TANF adults into programming. And it's not entirely fair to draw causation here, but to see ENT program enrollment meet and exceed pre-pandemic levels suggests that when we're offering flexibility of options of engagement, adult TANF recipients participate in programming at similar, if not higher levels than if they are forced to participate. Next slide, please. So now 2 years into our redesigned program, while we're happy with what we've seen so far, there's still plenty of work to be done. So sticking with our key theme of strengthening our programs through ongoing engagement, right? Ask early and often. Moving into 2022, we're going to, again, continue to be asking our stakeholders, how are we doing and what more can we do? So in 2022, our continued engagement will be driven through a couple of mechanisms. So one, we're doing some pretty significant work internally as a department and engaging staff at all levels and across teams to identify some, really specific program issues to develop solutions. So this, I know it's really hard to see. I hope I can share a graphic of this later. This on the left side of your screen, the Circles of Influence tool has been incredibly helpful for us as we map out which stakeholders must be engaged and how they must be engaged. So for example, do some of our stakeholders need to be consulted, kept informed, or specifically involved in the implementation of our plans? So far, this mapping exercise has resulted in the creation of some cross-functional work groups internally. For instance, work groups have been stood up between ENT policy and program staff and our eligibility workers to ensure that we're learning from one another, particularly on how to best, quote unquote, sell our programs to our participants, recognizing that there's opportunity to message value and opportunity for engaging in our programs, even in the midst of a set of policies that requires, right, that engagement in our programs is mandatory. And 2, we've recently conducted a series of listening sessions with our local workforce development boards and are currently developing recommendations for solutions to address their current 2022 pain points. At present, they're mostly related to increasing the quality of our program as specifically measured by customer satisfaction. Again, that's another way that our stakeholder engagement and feedback loops are being incorporated into our design. We're also interested in establishing a program evaluation framework that captures barrier remediation services that we included in our 2020 design. We are looking, as always, continuing to find ways to alleviate administrative burden on our participants and our providers, continuing to expand our education and training operations or opportunities, in particular to be in alignment with today's high growth occupations. And of course, continuing to work closely with our partners to share actionable data that can drive continuous improvement on a more regular basis. So we're still very much so at the drawing board here in 2022, and I think that's a forced kind of startup mode. But we're feeling really bullishly optimistic that we're on the right path, not just to create, immediate solutions, but also to continue to build that trust and collaborative relationships that will sustain all of these changes over time. Thank you.
And with that, I think I'm next. So good morning, everyone, or good afternoon for those of you that are not joining us on the West Coast. My name is Christina Mesa, and I am here on behalf of the California Department of Social Services, where I work in support of our TANF programs in California, which we refer to as the California Work Opportunity and Responsibility to Kids program, or Calworks. Really excited to be here with you all today to review different components that we've been able to build into our program that support and align the 6 core principles of TANF modernization that Mary covered earlier in our presentation today. We will have a heavy focus and emphasis on the COVID response efforts that we've been able to employ here in California, many of which we now have had the ability to move into permanent fixtures within our program. Or they've opened the doors of opportunities to expand how we offer Calworks to, again, better align with those principles of TANF modernization that we covered earlier. With that, can we go to the next slide, please? Thank you. So starting first with a quick snapshot and look at some of the COVID-19 relief efforts that we've been able to employ here in California. We have a list here of the items that we were able to implement over the last couple of years that we believe heavily align with those TANF principles. First being economic supports for our families, right? We were able to employ 2 direct payments to our families, one of which many of the states here received funding to support at the federal level through that Pandemic Emergency Assistance Fund. We were able to send out a payment last July to our families using those funds. But in addition to that, the state also allocated state dollars through our state general fund to support an additional $600 payment to our families that we titled the Golden State Grant. In addition to those one-time payments that we were able to launch last year, we also waived and/or delayed a lot of the in-person eligibility requirements or verification processes. And so expanded on that just a little bit here with a list of some of the areas where we were able to implement those waivers or delays. We also, in California, stopped all of our state-funded time clocks during the pandemic. So this is currently still in place. Nobody's time in terms of that state-funded time clock or time on aid limit is being counted right now. That all ends in May of this year, where we in California are moving towards a state-funded 60-month time clock to align with the federal time clocks. So we were really excited to be able to at least give some reprieve to families to ensure that those time was not ticking during the pandemic for that state-funded clock. We were also able to align again through some of the federal policy initiatives around waiving that pandemic unemployment compensation fund payments that were going out to families that were receiving unemployment insurance to ensure that there was no impact to their TANF or SNAP program benefits. We also provided special relief related to overpayments for families to ensure that folks were not being asked to repay overpayments where there was likely an administrative error or reduce that payment amount. We also increased our diversion limit to 200% of the federal poverty level. We implemented blanket good cause, much like the Pennsylvania moratorium on sanctions, to our welfare to work participants. And then we also employed several remote options, one in the space of telehealth to support our Calworks home visiting program. But the other, if we could go to the next slide, is specific to our welfare to work program. So we were really excited to support our welfare to work participants through the pandemic through the launch of a new partnership to offer distance learning, not just distance learning, but just a remote engagement tool through an organization called CellEd. They're a global nonprofit organization that specializes in offering education opportunities and programs in what is known as education deserts, where there likely is a lack of access to education resources. For us here in California, CellEd has been able to provide education as well as vocational learning programs and courses, ESL or English learner programs, work readiness workshops all through their virtual platform that can be easily accessed through a mobile phone, a tablet, a laptop, a computer, most electronic devices. Not only is it accessible in a remote environment, but participants can engage even if they don't have access to the internet, which was, I think, a really critical component to why we decided to partner with CellEd. So while the application, the courses, and the learning opportunities are available through a web-based application or iOS application or an Android application, they can also be accessed via text messaging or calling in, and participants can even engage in CellEd courses through WhatsApp, which is a really popular application that many of our participants utilize. So it just makes it better for, provides more opportunities for participants to be able to engage in welfare to work, just given the circumstances surrounding the pandemic and having to move to this remote environment. We decided to expand CellEd access not just to our welfare to work participants, but on the SNAP employment and training side, we've made those resources available as well as through our refugee partners. And then of course, through our home visiting program that we have here in Calworks. We also have worked in heavy partnership with our WIOA partners and workforce boards. So some throughout the state have also employed or deployed CellEd as a resource for some of the folks that wanted to engage in work-based learning to make it easier to access program services when there is co-enrollment between WIOA and TANF. With that, next slide, please. So I mentioned earlier as we went through that list of the different COVID policy relief efforts that we were able to implement in California, that we had several COVID policies and some of those initial relief efforts that we were able to leverage and make permanent fixtures and build that into our program. And that some of those also open the door to offer other changes to our TANF program here in California. So we have, again, another short list here, some of those policies that we were able to move forward as permanent fixtures in our program. I think the three that we have highlighted here closely in line with those 6 TANF principles. And so we wanted to highlight the efforts behind those 3 policies. One being around our pregnancy eligibility, expansion, and verification flexibilities that we were able to, again, make permanent as part of our program. But we also wanted to touch on some of our outreach efforts to connect our families back to economic supports and other supports that help with that physical and social well-being aspect of TANF. We also wanted to touch on Calworks. So a lot of work happening in our outcome and accountability review process, which was kind of our version of TANF modernization here in California that launched a few years ago. But there were some changes to how we went about that we wanted to highlight and share with you all. And then, of course, we are starting a statewide racial equity and implicit bias training, which we'll speak about in just a minute. So moving first into our next slide, where we highlight the pregnancy changes that we were able to implement in Calworks. The first is specifically around the verification process, making sure that clients were able to have some relief when it came to verifying pregnancy status. So in California, we had some medical verifications that were built in to the verification process, but now what we've done is we've allowed for self-attestation and allowed for expanded timelines on when those medical verifications would be needed, if needed at all, to verify that pregnancy. We also made some changes to welfare to work participants. So if we have a participant who is pregnant, they're exempt from welfare to work through state-funded efforts. We were also able to expand on a pregnancy special need payment where we're giving our pregnant recipients $100 a month on top of their cash grant to support that individual through their pregnancy journey. And then, of course, we've expanded eligibility for all. Once somebody knows or is aware that they are pregnant, they can become eligible for Calworks if they were otherwise eligible through the traditional income verification process. So a lot of exciting efforts to really support those pregnant recipients. I also want to highlight one area that we did not cover here, but just as a priority in general for us in California and for our legislature, is around better supports for pregnant Californians more broadly. While we have this expanded effort here in our TANF program, we also received a $35 million investment in state general fund to launch a guaranteed income pilot across the state, where we are asked to target either pregnant individuals or individuals who have timed out of the foster care system. So really excited to support that effort, and there will likely be close alignment with our TANF program, just given the populations we'll be serving. So once that unfolds and as we expand on some of the evaluation efforts, there's a lot of lessons to be learned, especially around work requirements that are built into benefit programs versus a guaranteed income program. And so excited to see some of the evaluation efforts in that space. That next slide, please. So Mary mentioned the North Star language that was built into the TANF modernization work. We in California received an investment from our legislature last budget cycle to launch a statewide implicit bias training alongside our race and equity plan that we're launching as well. This is all in support of the work that we're doing in the Calworks space, which I'll speak to in just a minute, but also something that we've coined as Calworks 2.0, which is definitely county driven here in California. So we are a state administered program, but the services themselves are offered at the county level. And counties worked a few years back to launch what we called Calworks 2.0, which really focused on the long-term outcomes and intergenerational approach to how we design our program to better support families and the success of our families. And so through that effort came Calor. One of the areas that was highlighted there was to be able to launch a statewide training just around implicit bias, and then also how we build race and equity into our system improvement process. Next slide. The other area that we wanted to focus on for the presentation today was around some of our targeted outreach efforts. Mary spoke to that core principle number 1, right, which highlighted the physical and social well-being of our families. So in California, really excited that we were able to get access to state park passes that we coined the Golden Bear Pass through our partners at the California State Parks Department, as well as the First Partners Office. To make those passes free for our Calworks families, our TANF families, and we were able to make that access to that pass as easy as possible by verifying the eligibility using data matching processes on the back end. So that way, folks that are on Calworks automatically receive that Golden Bear Pass if they wish to receive it. So we did targeting messaging campaigns to all of our Calworks recipients to get access to that pass, and really excited with some of the initial numbers. We just launched this a couple of weeks ago. So in the first 2 weeks, we have just under 4,000 passes going out to families. To put things into perspective, all of last year, I think we were able to, for the entirety of the year, release 3,000 passes. So we've already surpassed in 2 weeks what we were able to do in previous years. So really excited about this effort and making sure that families have access to our state parks here in California. Next slide, please. So I mentioned throughout the presentation the Calworks Outcomes and Accountability Review process, or our CalWAR cycle. This is a local, meaning it's administered at the county level, data-driven program management system that helps facilitate continuous quality improvement within our TANF program through collecting, analyzing, and disseminating outcomes and best practices. Again, prioritizing barrier removal for our families to support long-term outcomes at that family level. This is a 5-year cycle. There's 3 components that are built into our CalWAR effort. I think at the heart of it is the county self-improvement plan. And through that, aligning back to one of the principles as well, it is definitely peer informed, meaning counties can help support each other through that process. But there is also a client survey element that's built into it as well, so that the client is informing program design and CQI through that CalWAR effort. We have a link here to some additional resources related to CalWAR and where we're at in terms of the data collection and how we're informing moving forward at a state level changes to support our families here in California using the CalWAR metric, but really excited about this effort, and more to come as we unfold this 5-year process. With that, I think that was it for us here in California. So I'm going to turn things back over to our host.
Thank you, everyone. My name is Ade Adeniji. Mary Roberto continues to have some technical glitches here, so I'll take us quickly through the question and answer. But before then, there are questions the panelists would want the participants to kind of reflect on, and they're broken down into like four parts. The first one is what resonated with you the most during the event? What are some ideas or tools you heard during the event that you might want to use or implement? The next reflection is how are you going to hold yourself and your partners accountable to implementing those ideas? And the last but not the least is what do you want to learn more about following this event? How will you seek out the knowledge? So, going forward, we want to hear from you. And if there are topics that you want covered, please feel free to communicate with the panelists, which and the contact person on the call here, in the person of James, and Debbie is going to read out the contact information and so forth toward the end. I'm going to go through some of the questions that came in during the presentation. Some of them were referred to the panelists, and others were just general questions. The first three questions that came in centered around if the presentation was going to be shared and where you can get access to the presentation. Yes, this presentation, first of all, was recorded as the host mentioned in the beginning, and this is going to be made available to all panelists as soon as we go through the 508 compliance and everything is ready to be shared. Also, the next question mentions that 4 out of 6 goals in a particular state are centered around a multi-generational approach. This particular state is participating in TLC, and they're eager to learn how they can create tangible policies that support this approach. So I'll turn it over to if any of the panelists can chime in to answer this question.
I would say, one of the things that you all can do, and I should have mentioned this earlier, is if you are a TANF administrator or staff at a state or local public human services agency, you can join our TANF modernization efforts and then have that opportunity to engage directly with your peers on some of these conversations. And then the other thing I would say is definitely keep an eye out on the materials that we've been producing, which we really have, I think, tried to lift up state examples that speak to these core principles like you've heard today. And other than that, of course, we're here at APHSA. If you ever have any questions about TANF, feel free to send them our way. We're happy, of course, ACF should be your go-to, but we're also happy to support you all in the work that you do as much as possible.
And I'm just going to add something. I think I heard that either it was the state that was saying that they are a part of TLC, or maybe so North Dakota is also a part of TLC. So we're a part of the TANF learning community that's currently going on. And I think I heard that the question asked if and how we plan on making some of our strategies tangible to implement. And I think that's one of the biggest things that we've struggled with as a state in North Dakota is how do we start to implement some of these more complex things? What does intergenerational look like for North Dakota? And we've really found a lot of value and benefit in collaboration, collaborating with TA, collaborating. I think that we sit in, we listen on the modernization work group as well. We listen in on anything that we can get our hands on because we're learning and we're okay with wearing the learning hat. And we're okay with collaborating with others because as you can see, there's a lot of information and a lot of states are doing a lot of different things. So I would say, as an approach to just making it more tangible, just being open to collaborate and connect with people on how they might have gotten started, because I don't think that there's any one specific way to do it. And then once you start to dig in, you'll find that others have kind of struggled, and they can help you along with that process.
Thank you so much. Thank you both. Uh, the next question came in, I believe, when Ms. Pham was presenting around the ENT redesign assessment. The question reads, is the assessment you used available to see, or can you tell us what the assessment consisted of?
Whoever asked that question, thank you so much for posing it. I think you'll see this pretty consistent, or I should say, it is a pretty consistent theme with our redesign that we've tried to establish bumper rails and guidance to our providers, while also allowing for the flexibility for our providers to customize how they implement our guidance at a local level. Again, I think that's out of respect of the expertise of local communities designing local solutions. So for our whole family assessment, again, in our contracts with our ENT providers, we really sought to set up sort of the bumper rails for what that whole family assessment looks like, with the expectation, again, that our providers had the opportunity to kind of shift and add components as they saw fit. But at a minimum, what we sought to capture were kind of an assessment of the social indicators of health. So assessments related to the individual's and family's interests and goals, household composition, current employment and financial status, educational experience, language and English proficiency, housing status, food security, clothing, transportation, and the list goes on. But really it was an attempt to capture a very wide view of these social determinants or social indicators of health that have direct implication on an individual and family success in our ENT, not just our ENT programs, but their long-term financial stability.
Thank you so much. I want to be mindful of the time. We're going to address as many questions as we can. Ms. Pham, the next question is also for you. It goes, how does the PN provide access to mental health professionals and so forth?
Oh, great question. So for access to mental health professionals, we set the expectation with our ENT providers and further backed it up with additional investment and kind of budget allocation to our ENT providers to either hire as a full-time staff member a licensed counselor on staff, or at least make availability through on-call professionals. I think by and large, we definitely did not set it as a requirement that our ENT participants had to engage with a mental health professional. We simply set it as expectation that with our providers that they be made available, that our participants were aware that they had this as a resource to engage throughout their connection to the program.
Thank you so much. There are two more questions that I have to cover, and the next one reads, and this one goes to any member of the panel. How can TANF programs better support career pathways, which take time and resources to support families' economic well-being? Do TANF priorities need to change to support a long-term effort like this? So again, how can TANF programs better support career pathways, which take time and resources to support families' economic well-being? The second part of that question is, do TANF priorities need to change to support a long-term effort like this?
I can start with what we've thought about in California, because I think this is something that, I think in the presentation towards the beginning of the conversation, Mary kind of highlighted some of the areas where there is opportunity to align with our partners in WIOA, who are able to provide additional support for some of our families that we're servicing in this area of long-term career trajectory and career growth support. One of the things that we prioritize is this emphasis on goal setting for our participants, again, that you heard towards the beginning of the conversation, around where they would like to see their career grow, right? What areas, what sectors provide the economic support that's needed for the success of their family. And one of the things that we prioritize is entries into career pathway opportunities that will help them develop in that career trajectory. So one area, one prime example is looking at things like pre-apprenticeship programs or support through vocational training programs that provide an entryway into a sector that is the sector that they've selected as part of their goal setting effort. Pre-apprenticeship programs we find to be highly successful in ensuring that folks get that support that they need as they enter into that pre-apprenticeship and then move on to a more robust apprenticeship program and eventually into the career that they likely had selected as their career choice. Well, there's a lot of growth to be done in that apprenticeship space. I think there's other opportunities through vocational training and our partners in adult education who are thinking through those same solutions, and so wanting to build up the partnership in that adult education space as well.
Thank you, Christina, and I want to thank you all for the reflection questions that are already coming in. But with that, because of shortage of time, I'll turn it over to kind of give us final housekeeping and next steps here.
Thanks to everybody. I'm going to go ahead and give you some direction on how to access technical assistance through the Office of Family Assistance, and then I'll hand it over to James to close us out. But this last slide really does, give you some information about how to get to us. We have a lot of fun providing TA and helping programs along on their journeys towards modernization and innovation and other things. So we invite you to take a look at the PeerTA website, and there's also just a ton of information on there about the journeys of other programs towards modernization, and then digging down into the elements of that, whether it be client-centered coaching or career pathways. There's a number of materials on there about connection with career pathways, not necessarily for human services programs to develop those themselves or TANF programs, but how to maybe align or walk beside some of the workforce programs around the country to do that. So tons of information there. We invite you, if you need help or want our assistance, to go ahead and request it through this through the link here. And with that, I appreciate your time, and I'm going to pass this along to James to close us out.
Thank you so much, Mary. And we just want to thank everyone for participating in today's webinar. And we hope that the session has been informative to you, and we look forward to continuing to work with you as part of our OFA PeerTA efforts. If by chance we were not able to respond to your question today via the chat box, we will answer those questions and make them available shortly as we do a follow-up to the event. If you have further inquiries, please contact me or Mary at the email addresses that you see listed on the slide before you. So thanks again, everyone, and to all of our presenters, Mary, Bianca, Joan, Wah, and Christina. And thank you all of you who joined us today and took time out of your busy schedules to join us. And everybody, enjoy the remainder of your day. Thank you so much.